Welcome everyone to Frontrunners Innovate, where we connect you to global leaders meeting the world's challenges through business and innovation. Today's guest is Anke Weisheit. She is the Chair for Innovation and Business Management for Pharm-Bio and Technology and Traditional Medicine Center in Uganda. It is an innovation incubator program in biopharmaceuticals, and she's also the founding board member of the Friends of Pharm-Biotrac Foundation. She'll tell us more about all of this, and if I mess that up, she will definitely straighten us out. I appreciate that. Anke has over 20 years of experience in private sector development, business planning, mentoring, and advisory services, project and program management. Her expertise includes herbal products and medicinal plants, along with other key skills and intelligence that brings real leadership to the incubator environment, where we like to see that happen and grow, especially in Uganda. Co-hosting with me today is Dr. David Ajibade. He is a physician, educator, and founder of the Brain and Body Foundation, situated here in the United States. Dr. Ajibade is noted also for having Africa's best health TV show. So welcome to you both. Thank you for being here. Also to everyone else, I'm your host, Mary Kirk, CEO of Frontrunners Development, a global business development company that connects business to change the world. Special welcome again to our guest and our co-host. So I'm going to start with our co-host first, because once we get to Anke, we're going to be situated there for a little while. So Dr. David Ajibade, would you like to talk to us just a little bit about what you're doing?
Okay, well, thank you for having me. Great to see you again, Mary and Anke. Nice to meet you. So, like you said, I run the Brain and Body Foundation. Our main goal, our main focus is to find solutions that can be applied, not just in urban areas where you got all the top expertise at hospitals, research centers, and all that, which are in abundance in the US, but also in third world countries, especially Africa, where we don't have most of these things, but we have a lot of brain disorders and cardiovascular disease, and these things are only increasing. And so we at the Brain and Body Foundation are looking for ways to find safe, practical solutions. A lot of them, yes, include nutrition and nutritional supplementation, some other things involved as well. But not only that, but also to whatever discoveries we make to make them as widely known as possible. So we engage the TV, the radio stations, of course, social media, online, every way possible to educate people around the world on what they can do to improve and maintain their brain health first, but yes, general health as well into their 80s and 90s.
Fantastic. We are living longer, aren't we? We are. Indeed.
We are.
Yeah. So, Dr. David,
maybe not healthier, but longer for sure.
Yes, for sure. And we really appreciate getting a chance to see your very own broadcast on LinkedIn very often. So thank you for sharing all of that. I love the work that you're doing in dementia, Alzheimer's, and all that arena that hits the memory care area of our world. So thank you. Anke, this is really a little while coming, and we really appreciate the opportunity to have you here and really talk to us about what you're doing in Uganda with the innovators that you're working with there. So why don't you do a more thorough job of introducing yourself, and then tell us a little bit about the background that you come from to bring you into this line of work.
Thank you very much, Mary and David, for having me here in the podcast. Myself, I'm Anke Weisheit. I'm born and raised in Germany, and for now 22 years I'm living and working in Uganda. And first I started working in a medicinal plant project in Western Uganda. The place is called Rukarava Partnership Workshop for Development, and there I worked with 5 herbalist associations, which each around 150 herbalists worked together for 3 years in promoting medicinal tree planting at farm, and also in basic improvement of the processing of the herbal medicine, processing, packaging, labeling, and so on. So that was my basis. During the time, I realized that the traditional medicine practitioner and allopathic medical practitioners seems to have a bit of a blockage working together. when I interacted with a herbalist for the 3 years, I understood that there is a challenge between the traditional and the modern hospitals and clinic and doctors working together. So I made this a kind of a long-term plan to try to fix it or try to improve the relationship between the two healing systems. And so I came to Barara University, developed the concept of establishing an Institute of Indigenous Knowledge and Science at Barara University. On that concept, I submitted to the university in 2006. Then a committee was formed by the Vice Chancellor, and the proposal was further developed. But it took a long time, and only in 2015, when the World Bank made a call for Center of Excellences, there was a call. And then I was called in, and the professor says, yeah, Anke, there is something on IK. You are the IK lady here. Form a team and write and address this problem, this project proposal. So it was good because during my time in MAST, I had already worked with several people, so I know who could be interested. So I approached Dr. Kasim Umbatolo. That is the current center leader of Pharmaceutical Biotechnology and Traditional Medicine Center. And then we together formed a larger team and wrote the proposal for the World Bank for Pharm-Biotrac. So in total, the project writing process was for 2 years. And then in 2017, we started set up the center. We established labs. There is a production lab, a biotech lab, and an analytical lab, which was also facilitated and equipped by the project. Then we recruited students. In total, we have recruited 30 PhD under full scholarship and 60 masters under full scholarship. Now the PhD have overarching area of work. There is the herbal medicine, there is the pharmacology, pharmacognosy, there is the clinical pharmacy, product development, the production of herbal medicine. As well, there is one PhD student who is working on African spiritualism. Now the masters, our program developed 3 new masters program. One is clinical pharmacy, another one pharmacognosy and traditional medicine, and the third one is pharmaceutical analysis. Now these programs are not only national accredited by the National Council of Higher Education, but also accredited by ASIN, an international accreditation body based in Germany. So these 3 courses are international registered, accredited. Now, right now we have graduated 22 PhD and the masters. In total, we had an intake of over 120 masters. We also have an innovation incubation program where we support small-scale industry and innovators in the establishing of small enterprises. We have so far an intake of 2. Our innovation incubation program is in various fields. This includes traditional medicine, herbal medicine, natural cosmetics, nutraceuticals, pharmaceutical ingredients, and supplements, as well as healthy beverages. Therefore, we have students in total from 11 African countries. And in the incubation programs, we have Ugandans and 1 from Nigeria. Also, we have so far 100% employment rate for our PhD students. One is now the science director of the Ministry of Science in South Sudan. Another person is a director of a natural medicine institute in Tanzania. Another one is in Congo, who is the dean of the Faculty of Medicine. Another one is again a dean faculty in Rwanda. So others become entrepreneurs. One is also now a headmaster of a secondary school. So we have people from in different higher professions right now. And that is very important because the idea of integrating traditional medicine program of countries is very important, that we have the human resource established and qualified to do so.
This is good. Yeah, take a break for a minute, Anke. David, do you have any comments so far or questions? I noticed you're kind of taking some notes there.
Yeah, I'm just impressed with the extent of work you're doing, the academic work, and I know that's a very, very important aspect of bridging that gap between traditional medicine and allopathic medicine. That's a huge problem, and just the fact that you're doing the rigorous work needed to bridge that gap is really commendable. PhDs and you said 125 masters altogether, right?
Yeah.
You've graduated from this school, and these are all in Uganda, or are they online or around the world?
No, physical. This was a physical program. In total, our students came from 11 African countries, face to face.
Wow. That's very commendable. That was what just stood out to me. I think that's a lot of that is needed, and I hope you can expand that significantly as we go along.
I think that's the aim here, is to grow the program. Yeah. Talk about what's happening right now with the program and where you're headed.
So right now, we are in a phase of expanding, and if possible, also we are interested in replicating the program. So we have developed a concept of establishing a campus inside our university. So that campus will comprise of physical infrastructure, of labs, specialized labs, of a production facility, of a training complex with a guest house and a botanical garden, of which land is already secured. We have also fenced the botanic garden, partitioned it, and start populating the botanical garden. It is very important that this subject is actually put into physical infrastructure so that we can have bigger cohorts and more intensive training, and also capacity building, including hosting international professors, hosting international experts, which we're already doing. When the physical infrastructure more or is established and dedicated to Pharm-Biotrac, then we can also host larger experiments on larger research. In the long term, we also plan to have a natural healing center, or simply say a hospital for using herbal and traditional medicine. Then in the future, traditional medicine is one of the future options of health. And this can also assist globally in providing health for the people in need, and also providing conducive environment for research and development. For example, the processing facility. If we have a processing facility central located in our center, small-scale producer who cannot yet own their own factory, GMP, the good manufacturing level factories, can now produce, as a contract manufacturing, can produce their products with our quality and certified center, and then can sell it under their own name, but with medical and National Drug Authority approved processes and procedures.
It's a neat idea. Like that. You know, as far as, Anke, as far as funding goes, what comes to my mind I think if I heard correctly, what started this was an approach to the World Bank Group. and an answer to a call for a grant process. Is there any chance of re-engaging them to help with expansion?
Yes, it will maybe take 2 years, and it's not 100% promise. So we need to make sure we keep the ball rolling and not stop the process and wait. We have to be active. And there are different options. We can start small by having other cohorts of master PhD and also of incubatees. These are the SMEs. As well as, I forgot to mention earlier, we have trained over 800 herbalists in their communities. So our teams go out with a bus and train herbalists where they are. So on-site training. We are now also developing an in-house short course, professional course of 1 month, where health practitioners, doctors, pharmacists, or our common person can attend and gain insights in the procedure and processes of herbal medicine making. So look for grants that we can continue taking in cohorts. As you know, Africa is big. We need more human resource. We're just one center doing the work, but we need more cohorts coming in so that in the end, when people build enterprises and build industry, we have the human resource to actually run it. Because developing a sector needs the human resource and then infrastructure. So this would be the first step, to continue having cohorts. Another progress is to build the infrastructure. Maybe someone is interested in assisting us with establishing the botanical garden. We have the human resource. We have a professional trained botanical garden curator from Botanical Garden of Kew. He has worked there for many years and was trained in botanical garden management, who is also helping in Shanghai Botanical Garden. He's a Ugandan national. So human resources there. Then another could be interested in a training center, which has the teaching halls, the lecture and boardroom and seminar rooms, plus the hotel or the guest house. It's a guest house, 50 key guest house. Another maybe is interested in the lab, to set up a state-of-art lab. You know, a lab has different buildings or different rooms in a building. Each one has his speciality. So in the moment, the labs are small and not differentiated the way they're supposed to be differentiated. Means a certain work is in a certain room, because each one has his own climate, his own hygiene, his own procedure. Another one may be interested in putting up the production facility, the contract manufacturing. This one will have different lines. There will be syrups, there will be ointments and creams, there will be tablets and capsules, there will be powders and teas, so on. That is, so there will be different lines in that processing facility.
May I ask a question?
Yes.
Okay. So this is, I can see that this is a very comprehensive and extensive outlook you have, and the needs are, of course, massive. But I'm just curious as to some of the results you've been getting. I know you trained about 800 herbalists. Could you kind of give us a picture of some of the health conditions that you have helped to work on in that environment? I know obviously there might be rules about saying whether you treat or you cure certain conditions. So obviously I know you take that into account. But just wanted to have an idea of some of the health challenges. Also, do you now have these herbalists or these traditional healthcare professionals? Do you have them work with the allopathic healthcare professionals? Do you have them go to the hospital? It's kind of like, if you can just give us an idea of how that all works together, in addition to your academic papers and all those things.
Yes. So let's work first to get an overview. We can talk about the incubatees, the 30 incubatees, and talk about what
Like I asked the wrong question.
Yeah, there you go. People
Diabetic,
around. Go ahead.
yeah, diabetic wounds. Then another one works on wound healing with using fish peptides. Another one has produced a spray for general wound healing. And that spray is also for wound infection like fungal disease or the bacterial disease of the skin. Another incubator works on malaria. There's a medicine on malaria. Another one works on animal health. We have one on animal health, one on plant health, plant pesticides, yeah, diabetics. We have also a medical work. This is a clinical trial we finished on supplementary treatment of HIV patients who are on ARVs. So we treated them with artemisia and moringa-based herbal combination, and we found out that the CD4 counts go better up. They become, in general, better healthy than only ARV. That means ARV plus the herbal treatment.
Good.
So these
good.
are some diseases. For the herbalists, our training is not yet straight on disease 1, disease 2, disease 3. No. We are doing right now basic training. This is hygiene, record keeping, quality of medicine making. You record what you do. Like when you make the medicine, you record it so that you can keep the knowledge. We also patient ethics, sustainable harvesting, how to handle the medicine, the general anatomy of the body, general function of the body. So these are some of the elements we now train. Of course, in later phases there will be maybe disease related, but right now it's a common skills development, which they can now apply on the different diseases.
Okay. And do you have them working with the allopathic doctors yet at this point, or no?
We already formed them. The project has no outreach right now in that field, but it's done. We already sensitizing the traditional healers that when the patient is not able to get better with his or her treatment, early referral to either another herbal treatment or to the doctor is important. And we're also emphasizing on writing small notes. What is the patient, what has he done, what is the challenge, so that the communication between the two are enhanced. I know there is informal referral system to both sides. There are allopathic doctors referring to specific herbalists, and the herbalists referring to allopathic. But this could be a new intervention to make it more formalized, more streamlined, so that the communication between the two are improved. That is another area of intervention we can expand to.
Okay, that's great. Do you have any pictures or videos of your sites and what you've done so far?
Yes, I will share with you the links.
Okay.
Yeah. Yes, Anke, if you could send, if you have any photos that you can share, if you'll send those with captions, we'll put those with the interview that we're doing now on our website so that people can find those. And that would be great.
Yes, we have links. I have a set of links that I can just share with you.
Perfect.
Yes.
That's great. So,
and also the magazine.
What's that?
Yeah, also the magazine, which I had shared before. It's a magazine, it's a comprehensive documentation of our work.
Very good. So what is needed then is benefactors, partners. So raising funds and or getting a partnership or securing an individual that will help you with either pieces of the big pie of the big project, or somebody who believes enough in it altogether to be able to help you put it together. If you had everything that you need to have resource-wise right now, how long would it take for you to create the expansion that you are looking for, do you think?
With infrastructure building, it will take roughly 3 years because you have to make the plan. There's a lot of protocol, but in the end, by full funding, it will be 3 years to be fully functional. But meanwhile, constructing the physical infrastructure, we continue the way we have by taking in PhD, master, community outreach, and the innovation incubation process. So the processes will not stop when the infrastructure is developed, because the infrastructure is just next to it. So it will not disturb our work. We can have the infrastructure because we are not the one building. We're not putting stone on stone. They will be construction companies. So we continue our work the way I explained. Students, research projects, we can make competitions, having different researchable topics, grants for research, postdoc. You see, right now we have 2 postdoc positions. They are like 50% capacity in terms of their engagement. Postdocs is another way of keeping and preparing the human resource, because in 3-4 years, that big center need to be filled up with people. They need to be staffed. They need to have the right staff in each and every corner of the complex. We need now to continue and prepare the people. They will already know that when you succeed and you're hardworking, you will actually be retained and put into the center. So they will be aware when they start that. So this is now the approach when the full-fledged support.
Right. So do you have the support of the university there? It seems like to me that you have some location help or human capital help from.
Yes.
Yeah.
The university so far has several staff under the payroll. Also the center leader, the deputy center leader, they are permanent staff. They were staff before the project came, so they are still staff. So roughly 50% of Pharm-Biotrac staff is full-term at the university, and the university has already absorbed some of our graduates to become junior lecturer, assistant lecturer. Some became full lecturer because they have now a PhD, and they are looking forward to becoming senior lecturers.
Fantastic. So, Dr. David, last few questions or comments? Anything? Oh, you're on mute.
Sorry. Yeah, I'm just really impressed at the scale of what you are doing and attempting to do with the limited resources you have there. So I'm very, very impressed. And I really hope you get all the funding you need and the support you need to make this happen. Africa needs this, for sure.
Correct.
Yeah, definitely. Definitely does. I can see where partnerships in all the right places would be helpful. And I believe what you're doing is not just needed for Africa, but I can see it making a difference for Uganda. And I believe that, the need is there. If you're pulling people from other countries, you said 11 countries already, to me, it's almost like a medical tourism situation. I mean, if you can get to the place where you're utilizing the traditional medicine and the herbal medicines and all of those, vehicles to approach diseases where maybe, more advanced medicines and maybe not even doing what it needs to do, then I think you're gonna end up attracting people from other countries to come there to get treatments. And I think that's also in the long-term vision. You mentioned a clinic or a hospital there that you have. So that's at the point where if it hits economic development, then that hits the country's budget or the state's budget or the county's budget, regional government's budget, where they need to be looking at you as an asset, a benefit to the community. And that's the way that I think anyway. I'm a former Chamber of Commerce exec, so that's the way I think about things. Economic development, always, because that's what runs the world, really. So we will, Yeah, we will definitely be keeping you in our hearts, minds, souls, and prayers, and moving you forward with some of the things that you have expressed need for. Are there any particular types of people specifically that you have in mind that you'd like to meet to help you move forward?
Yeah, in general, because we are yet not commercially viable, I'm talking to a commercial chamber of commerce director. No, we are not yet commercial ready, and it should not be seen as a commercial investment ground right now. We are not ready because we need, this one is a service to the world, a service to the community.
So grants.
We cannot make it a profit making, especially maybe the manufacturing later, but right now training and development, even in Europe and in America, how many scholarships are given to people? Because the brightest minds may not have the brightest budget.
True.
And therefore, we need philanthropists. Philanthropists are individuals or companies that like to support our cause, as you said, either in small modules by providing operational support. That means salary and running the center, scholarships for students who can come in, national students, international students, and then we come to research grants. We come to infrastructure development. So there are different modules. Very important, it is philanthropic money, philanthropic funds, where there is no physical or financial gain or refund needed, because this is a service to the society, and therefore it's going to be as a grant, not as a loan.
Impact funds, that's what we call it.
Any size, small or big, is welcome.
Impact funds, yes, and for the corporations that may be involved, it's where it hits your corporate responsibility budget. That's where it is.
Yeah, correct.
Take some of your marketing budget and move it there, and then claim what you're doing for another country. Because honestly, when you put money like that into something like what she's talking about, you're making a huge gain. It's a ripple in a pond that just keeps on going, and it doesn't stop, because that's what we hope for. It's just like when I was involved in teaching youth development, youth leadership, is when they grow up and they come back and they sit on the board and they help train others. And it's that sustainable, ongoing, year after year, multi-generational approach to creating the greater good and making it move forward. So that's what we hope here.
Yes.
So I'm going to say thank you. You two stay with me just a minute. Dr. David Ajibade, thank you so much for joining me again. I appreciate that so much. And Anke, we wish you every best hope for moving it forward towards the vision that you have for this great endeavor that you have here, and hope that everybody will jump on board. And if they want to know how to get a hold of you and don't know how, we'll certainly share your LinkedIn profile. But if they want to reach out to me, I'll be happy to make that connection. So in closing, if you are a world-changing founder or innovator, fabulous connections are your best assets. And she just proved that.
Yeah.
So this podcast helps you by putting these connections in front of you. The innovators, leaders, and diplomats that we all interview are all looking for partners, and that could be you. And so there's no time like the present to find out. Go to Frontrunners Innovate to get this interview, to get information about these two individuals here, how to connect with them, and get busy making those connections. So thank you, everybody. We'll see you next time on Frontrunners Innovate. Bye-bye.
Thank you. Bye-bye.
Thank you very much.